Hello everybody and welcome back to Synapse. This is Ritika and in this video we shall talk about mitral regurgitation. Before I start with the topic for this video, I would want to mention that there's a series of videos on heart sounds, on splitting of S2, and the previous video was on mitral stenosis. Listen to that first so you can understand the entire concept very clearly. About mitral regurgitation. It is when the blood moves from the left ventricle to the left atria during systole. Let us first understand the causes of mitral regurgitation. The first reason is damage to the valve cusps, as in rheumatic heart disease and endocarditis, where the valve cusp is defective and thus it cannot approximate properly to prevent regurgitation. Mitral valve prolapse and ischemia of papillary muscle. This causes mitral regurgitation, and the reason for this is that the chordae tendineae and the papillary muscles, they hold the cusps down and prevent it from going into the left atria, and thus it prevents regurgitation. But when this chordae tendineae or the papillary muscle, this apparatus has been damaged, then the valves cannot approximate properly and thus it will lead to regurgitation. The fourth reason mentioned here is dilatation of the left ventricle, as in cardiomyopathy. This will lead to dilatation of the mitral valve ring. Though the valve cusps are normal in this condition, the valve ring has become bigger, which means that the cusps are relatively smaller. So these cusps cannot approximate properly and prevent the regurgitation, and thus there is mitral regurgitation in this. Now let us understand what is happening in mitral regurgitation. So here I've represented the mitral valves, and these mitral valve cusps are protruding into the left atria. So that is what happens in mitral regurgitation. So during ventricular systole, a part of the blood enters or leaks into the left atria. Although yes, there is some amount of blood going into the aorta too, but there is amount of blood leaking back into the left atria. So this will lead to a mid-systolic or an early systolic murmur, depending on whether it is acute or chronic. I shall get into the details of this murmur in the examination part. So the next thing that's going to happen is that there is a volume overload in the left heart, because the blood which has been pumped into the left ventricle by the left atria is getting pushed back into the left atria. It is not getting pushed forwards effectively, right? It is getting pushed backwards. So there is technically volume overload in the left heart, because of which the left atria undergoes some amount of dilatation, and so does the left ventricle. There is dilatation seen in both left atria and ventricle. And whatever blood has leaked back into the left atria has to come back into the left ventricle, right? There is nowhere else it can go. So when it tries to come back into the left ventricle during ventricular diastole, it may, in severe conditions, lead to mid-diastolic murmur too, which is a flow murmur. I hope the concept is clear. During ventricular systole, the blood is leaking from the left ventricle into the left atria, and this is because of the mitral valve incompetence, and this leads to early systolic or pansystolic murmur. But during ventricular diastole, because all of the blood that went to the left atria has to come back to left ventricle, there is a flow murmur, and this flow murmur is a mid-diastolic murmur. The main clinical features in mitral regurgitation is dyspnea, which is due to pulmonary venous congestion. This is more commonly seen in acute mitral regurgitation. And fatigue because of low cardiac output. There could be edema and ascites when the right heart failure occurs in severe cases. On examination, what do we see? You can feel a thrill over the left ventricle, and this is because of volume overload occurring in the left side of the heart. There is soft S1 and a wide split S2, and the reasons for this has been very clearly explained in the video on heart sounds and the splitting of S2. About the murmur that you hear in mitral regurgitation, in acute conditions you have early systolic murmur, And in chronic conditions, you have a pansystolic murmur as shown in the diagram. And I've also mentioned about the flow murmur, which is a mid-diastolic murmur which may be seen. Okay. This murmur radiates to the apex of the axilla. You could also hear crepitus, and there could be pleural effusion in this patient because of the pulmonary venous congestion. There could be pulmonary hypertension and the right heart failure signs. What investigations should you be doing in these patients? First of all, ECG. In ECG, you will observe the structural change in the P wave called as the P mitral, and this is because of the left atrial enlargement. You'll also see signs of left ventricular hypertrophy. The next investigation is chest X-ray, where you can see the enlarged left atria and the left ventricle. Pulmonary edema may be seen on the chest X-ray if it is significant enough or if it is severe enough. Next investigation is echo, where you can pretty clearly understand if there are any structural abnormalities in the valve, and definitely you can also observe the enlargement of the left atria and the left ventricle in echo. Next is the Doppler, where you can understand the extent of regurgitation, that is, you can quantify the regurgitation. Cardiac catheterization will give you a very clear picture of what is happening, but it is an invasive investigation. About the treatment for mitral regurgitation, we first try to treat it medically. We use diuretics, which will help to reduce the volume load on the heart, specifically in the left heart in this case. ACE inhibitors will be required in patients who have hypertension too, because in these patients the heart is already not able to pump out enough blood, that is, the cardiac output of the heart is reduced. And in case you increase the afterload for heart, which is happening in hypertension, you further decrease the cardiac output of the heart. And thus ACE inhibitors should be given to treat the hypertension in mitral regurgitation patients. Digoxin and anticoagulants will be required if there is atrial fibrillation due to atrial dilatation. In those conditions, you will have to use digoxin anticoagulants. Surgical treatment includes mitral valve repair and replacement, where repair is more preferred. This ends the topic of mitral regurgitation. I hope you found this video useful, and if you did, like the video and share the video. Subscribe to our channel if you haven't already subscribed. Bye bye until the next video.